Welcome to the Tarrant County Medical Minute Podcast.
All right. Hi, my name is Dr. Omar Salat. I'm your 2024 Tarrant County Medical Society President. Welcome to the Tarrant County Medical Society Podcast. Joining me today are partners in my practice. We're all PM&R physicians. So I'm going to go down the table here from closest to me all the way down the end. They're going to introduce themselves. If you could introduce yourself, how many years you've been in practice, and where you trained.
Yeah, sure. So I'll start. I'm Dr. Austin Watkins. I have been in practice for 9 years, and I trained at UT Southwestern.
My name is Dr. Benicia Williams. I have been in practice for 6 years. I trained at Baylor University Medical Center in Dallas, and I did my sports medicine fellowship at JPS/TCU.
And my name is Dr. Hayden Smith. I've been in practice about 2 years, and I did my training at Baylor University Medical Center as well.
My name is Dr. Neha Shah, in practice for about 9 years, and did my residency at the University of Chicago Schwab Rehab Hospital.
Okay, so all of us are PM&R physicians, physiatrists as we call it. What attracted you all to physiatry? I'll start with you, Austin.
Yeah, sure. I'll start. I think for me, there was just such a diversity in the field, and there's so many different types of patients that we could see. We're not confined to one body part, like a cardiologist, or perhaps a neurologist where you're seeing one organ system. We get to treat all comers, look at function and quality of life, and I think those things were big attractors for me into this particular field.
Yeah.
For myself, I was a kinesiology major in undergrad, so I always thought physical therapy was where I was going to end up, and I ended up in medical school, and I've always enjoyed anatomy, sports medicine, neurology, and I felt that physiatry was the perfect fit for all of those things.
And for myself, I found myself in medical school really enjoying my PM&R rotation and the focus that we had on function and getting to see some big changes that people made while they were in the rehab hospital and see what a difference a good physiatrist could make in helping people live with higher quality of life and regain their function.
Mm-hmm. Yeah, I would say the big draw for me in this particular field was that you got to see your patients actually take a big active role in their health, right? They are working towards a goal to live a different life potentially after a stroke, after an amputation, after a spinal cord injury. But, if they end up at our doorstep, they're wanting to get better. They're wanting to figure out how to live their new life. So that's, I think, a very unique aspect of medicine that maybe not a lot of different fields can see like we do.
So all of us train medical students and residents. We have interns with us every day. And the med students, what I tell them is that I can't explain physiatry. I can't explain PM&R. I always felt like when I was doing rotations, we looked at a patient this way, right? Mm-hmm. The medicine team is getting them stable, their vitals, in order, their labs in order. The surgeon comes in, does the surgery if needed, and then signs off the case. We come at it from a totally different angle. We're looking at the patient from function. Like, how are you going to deal with this disability, get home and be functional, whether it be a stroke, a traumatic brain injury, a spinal cord injury, an amputation, a back surgery, all that sort of stuff. So, it's hard to explain PM&R, I feel like, unless you come see it. And I'm always telling all those students, I can get up here and lecture you about it, but you've got to come shadow me, shadow one of y'all. And there's so much diversity, right? There's outpatient medicine. Most of us do outpatient medicine. Dr. Shaw is our inpatient rehab specialist in the rehab hospital taking care of patients. So it just, that to me, that was what was so attractive, how diverse it was. Yep. And I don't know how y'all felt, but until I didn't feel like till I actually got into residency, did I really, really notice that diversity.
Oh, totally agree. Yeah. Sheena Buva, one of my really good friends who practices PM&R, sport and spine in Plano, she always says that to me. She's like, Benicia, your practice is so diverse because I start in the hospital some days, I'm in clinic some days, I used to go to skilled nursing facilities some days, LTAC. So every day is a little bit different, which makes it fun and very enjoyable.
Yeah. I tell the students, like, on day one, today's like The Price is Right.
Yeah.
I don't know what's behind door one. Door two, it could be an amputee.
Yeah.
Door three could be a cervical radiculopathy.
Yep.
We do various procedures, EMGs, Botox injections for spasticity, for migraines, baclofen pumps. I mean, you literally don't know, and so that's what's pretty fun. All right, so the main theme of today's talk is private practice. I was in a meeting the other day where they presented numbers, how the majority of Texas is now employed physicians. And the overwhelming majority are employed physicians, and there's less and less private practice doctors in today's world of medicine. And the five of us we have another partner. She was unable to be here today. She had to go take care of patients. But we're in private practice, right? And so, coming out of training, right, like you have to make a decision, am I going to go down this path of private practice, or do I go this path of, being employed? So I wanted to pick your brains. Why did you all decide to do private practice? We can start with anybody.
For me, it was the autonomy was huge. And I knew I wanted to be my own boss ultimately. So I feel like being able to run practice and see the patients I want to see and how I want to do it was important. So that was a big draw for myself.
I'll say for me, the other job I interviewed at, they had a really narrow spot they wanted the physiatrist to fit into, and I like the idea of, like Dr. Williams said, kind of being your own boss and having some more autonomy on deciding how do I want my practice to grow, what does it look like in 5, 10, 15 years, and having that flexibility. If I decide, I'd rather focus more on the hospital side or the clinic side, to be able to kind of have that power to direct my career, as I would like moving forward.
To be perfectly honest, I was one of those out of residency that thought I was going to take an employed academic job. I hadn't even really toyed with the idea of private practice until I saw Omar at one of our PM&R conferences and really got my brain thinking to a different side of medicine that I wasn't exposed to in residency. But I would say, that I hadn't even really, it hadn't crossed my mind as an option even. So just, again, the flexibility, the autonomy can be scary, right? So it can feel weird and not necessarily normal in the beginning, but I think in the end it was the best decision that I could ever made, because it does let you grow into the type of physician you want and grow your practice in the way that you want as well.
Yeah.
I mean, I think, it's interesting listening to all of my colleagues, speak about their experiences, but I think, it's a little bit scary, private practice, right? You don't have someone telling you where to be, what to do. But there is a freedom to that is really, really liberating to be, to have that pathway to grow your practice the way that you see fit and to the way that you really enjoy. And I think it really helps you really take really good care of your patients, having that degree of freedom.
Mm-hmm.
So I think one of the things is, right, we have a lot of students, we have a lot of interns, residents hanging out with us, and we get tons of business questions. And I think one of the things that I found frustrating, and I don't know about y'all, but how little it's taught in medical school, and even when you're in residency, right? Like, you may be up at a big academic institution, and maybe those attendings worked private practice before, and so they can give you some counsel on it. But if they didn't, I mean, you have to be in it, what we're in, to really understand the pros and cons. So can any of y'all speak to that? Do you feel that there was deficit in training with that? Was it frustrating? How did you learn about private practice in your residency or med school?
Well, I can tell you I didn't learn about it at all. So yeah, it was a completely foreign concept to me when we had our first initial discussion. But it was just kind of eye-opening how little that even came up in topic of conversation, kind of where to go next after graduation, right? It was learn all the things, do good on your test, pass your boards, learn as much as you can and absorb all that knowledge. But that piece of what happens after you graduate wasn't really talked about much in my particular residency. I learned a lot. It was great, but I did feel a little lost at the end.
Right.
I think from my standpoint, I think we had a few lectures on it here and there. I think as a resident, the focus, like Dr. Shaw said, is so much on becoming a good clinical physician that sometimes maybe I didn't spend the time to digest what was being taught to me because I was so focused on the clinical side of things. And I think there's so much to learn as soon as you graduate. The questions you don't even know to ask as a resident or a student, that you're just inundated with new topics to learn when you graduate. And
so to that, I mean, that's a great point. Like, I don't think you know what to ask necessarily. Like,
Correct.
we give a lecture to the residents about an IPA. They've never heard of that. How do you get credentialed? You don't even know what to ask.
Yeah.
You don't know what you don't know.
Right.
They don't know what an IPA is.
Right.
Right.
We'll have that on another discussion, when we have time. But so it's scary, right? When you think about that, like, I don't know where I'm going. I don't know what to ask during training.
Well, even billing, I feel like a lot of residents, when they rotate with us in the hospital, they have no clue about billing at all.
Right.
And it's like, and then all of a sudden they are looking for a job, and I'm like, your billing is a huge part of finding a job and your salary. So I do think that's something that physicians need to be more transparent about when they are training residents, because I don't think it's talked about enough.
Right.
So we try to talk about it when we have third year residents. I'm like, hey, you need to have a job. You need to have your job picked out by December, because credentialing is going to take you, so long to
when
get.
Dr. Smith was our resident and we knew he was going to join us, Dr. Watkins, I'd give him the bill sheet.
Yeah.
And like, here he'd go, help us with an EMG. Okay, how do you code that, right?
Yeah.
Coding for Medicare versus Blue Cross. I mean, can you bill a consult versus new patient, right? It all can change, and it's complicated, but you have no clue about it.
Yeah, it's not taught well at all in medical education.
Yeah, unfortunately.
Unfortunately.
Which I think maybe, I don't know why, but why are there becoming less and less private practice? I mean, is it too scary, to go out on your own? Because when we talk to young docs about, okay, well, here's the cost of doing business, I mean, their first thing is like, oh my God, I'm never going to be able to afford that. And we're like,
You will easily
be able to afford that if you run,
I remember my first week at work, and I was like, oh my God, I made my attending so much money during residency.
Yes.
I'll speak to that. I had a bit of a different experience. My program director, his name was Dr. Sam Berner, was a former private practice physician, and was really thoughtful about trying to discuss private practice issues and explain to you his experience in private practice. And I think that mentorship, which I'm not sure how much that exists in today's residency training, was really, at least mentorship with respect to private practice, what your next steps are, was really helpful. And of course, you can't learn all the nuances of private practice, in an academic residency training, but to get some degree of exposure, I thought was truly helpful and invaluable, and gives you just a little bit of inroads into that world. So hopefully, if we get the chance to pass on that knowledge to our residents and students that we come into contact with, I think it's very useful.
Yeah. So some of you are a little bit more senior to others on this panel here in terms of years of practice. Tell me something that was like an eye-opening moment when you first started private practice. And it's not really about PM&R. It's just about starting private practice. What was something that you were unaware of when you started and were like, oh my goodness? Go ahead.
That Medicare does in-person audits when you apply for a Medicare number. And if you do not line up exactly what you put your start date was, they will deny you your Medicare number.
Which is complicated because you're taking boards.
Yes.
And you were a fellow. Right.
Yep. To make a long story short, yes, I was a fellow. Finished July 1st and started working September 1st, but I saw a couple patients early August at work to come before I started to get my Medicare number. The Medicare officer came and stopped by And the staff hadn't known I've already saw patients there. So they're like, oh, she starts next week, so they denied my Medicare number. So I wasn't able to get a Medicare number for like another almost 90 days, which means I couldn't bill Medicare, which is the majority of what I was seeing for those 90 days. The good thing is it worked out. I'm still working, but you can go back and bill Medicare retroactively. But it was a little...
it was eye-opening.
Eye-opening, yes, for all of us.
Yeah. What about y'all?
I would say one thing that surprised me was how much hustling it took on the non-clinical side to make connections, make friends, get to know the other doctors around town. You focus on residency so much on just seeing the patients, and they just show up to the clinic or they show up to the hospital. And on the outpatient side, they don't just show up unless someone sends them there or unless you get your name out in town. So getting to know other people and spending the time to kind of market and make your presence known.
I'd say also reimbursement. It's not in real time. So you're waiting 60 to 90 days when you're first starting to really see that money to start collecting.
Yeah, so you start seeing patients. And you're waiting on, I just saw somebody. Am I going to get paid? No. It's going to be a couple of months.
Yep.
So keep living like a resident, maybe even worse.
Yep.
Yeah, right.
Yeah. What about you, Doc?
I just knew nothing about starting a business and having to register a business and all of the paperwork and bank accounts and all of the intricacies that go into that. Things that I would have never thought of.
So it's funny you say that. So on our office, it says, Austin Watkins, DOPA, Benicia Williams, DOPA. People think that we are physician assistants prior to going to medical school, and we're like, no, PA stands for Professional Association. You're licensed as an S corp, and that's your business,
which is essentially like a LLC, but for medical professionals.
Right. So. Yeah, and that's the other thing, right? When you're in private practice, you are truly running a small business. And here we have kinesiology degrees, biology degrees, go to medical school, really don't have a business acumen worth a darn, in all honesty.
But we learned it very quickly.
And now, we're going to sink or swim.
Right.
And so, you learn from your errors too. Yeah. I know myself, I've made plenty of mistakes on the billing side, making sure collections are coming through or whatnot. But to that point, you have no idea about anything.
I think that was the good thing about our group is that we've all been able to learn from each other, right? Like, obviously, we learned a lot from you, but little mistakes like the Medicare thing, we're like, we know not to make that for our next doctor. So sharing is caring within our group, which is huge.
And you have to find that mentor, whatever field you 100%. Go into. If you want to go into private practice, you've got to find a private practice mentor to bounce ideas off, learn from them, and a good mentor is going to tell you, here's where I made mistakes as well, not just, here's how you do it and I make this much money. Life's not like that. You've got to learn from errors as well. Okay, so there are pros and cons to being on this side of medicine, and a lot of our friends, our colleagues are, employed physicians, and, much respect to them. It's, we chose this side, and that's fine. So we'll get into the pros in a second. What are some of the cons to private practice? What are some of the stuff that actually drives you crazy?
Well, I think my running joke is there's no PTO. There's just TO. There's only time off. I think it's, and I.
So explain that. Explain that.
I would anticipate that our employed colleagues have some sort of paid time off. In private practice, when you want to take a vacation with your family, you're still paying, your overhead, you're still paying your rent, and you're not earning any income because you're not currently seeing patients. And so I think it's something that it's one of those strange things that I just never really thought of, that when you want to take a day off or you get sick, or you want to take a week off with your family, that you're still paying your overhead and your rent and not earning any income.
It's a negative, right? Because then sometimes it's like, okay, I can take the day off, I'll be fine financially, but in your head you're like, oh no, I'm not making money. But we should probably take a little bit more time off.
It's a balance,
right?
I take a lot of time off. So. It is a balance for sure, but work isn't everything. So you work hard, play hard is how I view it. But no, that you don't work, you don't get paid. And that is probably the biggest drawback.
Well, so when COVID hit, Dr. Smith, I think you were a resident. You weren't with us at the time. But I mean, all 5 of us were scared and nervous because we didn't have a paycheck coming in.
Yeah.
The office was shut down. We could only do stat.
And we kept all of our staff.
Yeah, and we had to keep we kept them all through the pandemic. We got a little bit of PPP money, but still, it was a big financial hit. And during that time, you also didn't know how long this was going to last, where the world was going. But that anxiety, and we just moved into a new office on top of everything. Oh my goodness! But yeah, We survived. Yes, we came out okay. What other cons?
I'd say health insurance options, right? So
oh my gosh, yes.
I think that's probably, as a group, we can agree that cost to just get health insurance for yourself and your family is quite a burden in comparison to our employed partners.
Yes. It's funny, right? So like when I have a patient that's running a small business and they're complaining about, the insurance costs are too much, my deductible's too high. I'm like, it's no different for us. It's the same problem for us. We don't get, to buy bulk buying in a discount. It's actually terrible. And that's a whole other thing. Now my blood pressure's going up.
Right.
Any other cons?
So I'd say I've only been doing it for 2 years, but I could see the writing on the wall with like inflation and overhead costs, are only going to be going up, and trying to, keep that squared away with, making sure the rest of the business is going well, so that you can continue to keep the practice moving forward. I could see that being a challenge, now and moving forward.
Well, one thing that I think frustrates me, and I think this is why the medical society, I think as private practice physicians need to use the medical society more, because I don't feel like us private practice docs are unified.
Right.
We sit together in our meetings and talk about, okay, what do we need to do to survive and this and that. But our problems are no different than
any other specialty.
Be it ortho, cards, palm, right? And I don't think that we get together enough, even little things like who are you using for your Stericycle. Right.
Maybe that needs to be a committee.
That needs to be a committee.
Private practice committee.
But who are you using for paper? Who are you using for printing?
Yeah.
Oh my gosh, we're paying way too much. You have a better, cheaper option. I don't think because we're so inundated with the day
that you don't think
and
about those
costs, maybe we need to have an office manager meeting with private practice, stay connected a little bit more. But I do think the medical society is the one thing that brings us together, right? So you're in the hospital, you get to see a lot of physicians. I'm not in the hospital as much, and I've noticed that since I'm not in the hospital as much, I don't run into physicians as much, which drives me crazy. But through the medical society, fortunately, I get to see everybody all the time. Thank goodness for that. Otherwise, I would get myself a little bit more isolated. I feel like, and that's not good. But I think we need to collaborate a little bit more on that. Prior authorizations drives you crazy, Dr. Williams.
Yes, they do. And having to do peer-to-peers on the hospital side, it's very frustrating when you have a patient that has the benefit for, say, inpatient rehab, and they meet criteria, and having to spend time arguing for that patient for what is right for a person that might not be your peer, meaning they don't understand the physiatry side, and just explaining what we do as physiatrists and how they could benefit, and getting shut down is very frustrating.
Which is not a problem unique to private practice.
Right, exactly.
Everybody has to deal with that. But the time.
But I have to take time out of my day, to do it.
The cost of that, and we do it because we fight for our patients.
Of course.
Right.
But it is very frustrating, that part. Okay. And yes, to Dr. Smith's point, the cost, I think, is a little bit scary right now. And another thing that concerns me today with private practice, although I think we've all done well, is that, we don't have a healthcare entity feeding us necessarily in terms of healthcare entities are buying up more and more private practice, right? So, there may be some encouragement to send to a specialist that's also employed by that same entity. And for us, we don't, we really have to go prove ourselves. And even if you prove yourself, you still may not get the business. But I feel like I'm always having to prove myself. But I think that's good. I think that competition is good for medicine. And that's why, I do think for me personally, private practice is important to stay, because I do think it provides a level of competition amongst physicians, and competition is good. We also need to, make sure we're doing the right thing with our patients and whatnot. If I'm not, then by all means, go use somebody else.
Right.
Okay, so pros of private practice. What is it that you enjoy doing in the private practice sector?
I think for me, it's flexibility, right? You have the ability to shift your day however you need to. From a week-to-week basis, if needed, right? I am obviously not changing my schedule every single day, but if something were to come up, I do have the flexibility to say, I'm going to go to the dentist. I'm going to not see patients for an hour, and I get to do that, not have to take a half day off or put in
permission.
for PTO.
Right.
Don't have to tell somebody where you are.
Right. Your time is your time.
Yeah,
Right.
your time is your time.
I think even the same thing on a bigger scale of like, am I going to be spending my time at the hospital or at a skilled nursing facility or at the office, and kind of building that out? Because coming into private practice, I always imagined myself doing mostly outpatient, but I wasn't 100% sure on that, and then having that option to change as I move forward. If I fall in love with something else, there's not going to be anyone questioning that move or that change in focus.
And, and to your point, you can go to this hospital or that hospital. We can go wherever we feel that, our services are valued, I mean, if you feel no value to us, we'll go to another place. So yes, we have to earn business, but they have to earn us too, right? If we're not, happy with nursing or therapy or whatnot, we will redirect. So, and now that you're about to talk PTO, you don't have a limit.
No, you don't.
Right?
So I like to gallivant across the world often, but just to be able to do that, and you're like, hey, I want to take this week off. I just have to I block my schedule myself, and the staff will take care of it if there's patients that need to be rescheduled. But just having that type of autonomy, like I've said before, is the most beneficial thing for private practice to me.
Knowing there's a financial, cost to you.
Right.
But then you got to make it up on the other side. But
it's worth it.
It's your call.
Yeah, exactly. You feel like, I'm like, I'll take a hit, but I had an amazing week in Greece, so it was worth that,
Yeah. What about you?
I just feel that freedom to, see and treat patients the way that you want to without being beholden to anyone else, that would be potentially looking over your shoulder, seeing how you're practicing. I think just being able to have that degree of freedom is really rewarding, and that's a big advantage.
And I would say, I think, physician burnout is very real. And I think for us, we can control that burnout more so than probably employed physicians can, because we don't have someone writing us and say, hey, you have to see this amount of patients. You can't have the time off that you wanted to. So I think having that burden of it taken off
we
could help.
determine our productivity.
Exactly.
Right? So if we see less patients, we're going to make less money as long as we're able to put food on the table, right? And all that.
Right.
But we're not being told you have to see this many patients a day. You got
to speed it up. You can't spend this amount of time with a patient.
Yeah. It's funny because, my residents will ask me that, they'll bring contracts to me and talk about RVUs, I'll look at that.
We all know I have a very strong stance about RVUs. I believe it was made up so physicians don't know how much money you're actually making. It's my personal stance.
Well, I mean, you are making something, and you have for the most part, a fixed cost of doing business, right? So once you make enough money to meet that fixed cost, everything above that, and our world comes back to us. And so, but I get asked a lot about that. And, I mean, there's some great RVU models and opportunities and whatnot, but it's just not a world we live in.
Yeah, we live in dollars and cents.
Yes, and the transparency, right? We can see exactly how much money we made, how much money we didn't make,
Right.
what our exact costs are. We can get off those costs too. Like if we don't like what our billing company is charging us, we can go to another one at, for a lesser rate, as long as they're doing a good job. We can change who's supplying us our paper and whatnot. So, but that puts another burden on us. But I think for all of us, obviously, the benefit.
Right. There's that administrative burden that you have to do when you're in private practice, which I think that if you're an employed physician, you really should do as well, because you should keep track of how many patients you're seeing, what insurance they had, and how many RVUs you think are being billed. So, because I know a lot of them have a bonus structure based off how many RVUs you met. But if you don't keep track of that, you don't really know.
Right.
And you could lose money.
Right. All right. Well, unfortunately, I think we're running out of time. But one thing I want to finish on, a lot of our physicians are going down to Austin, taking time out of their day. They're not getting paid. They're fighting for us physicians. They're fighting for our patients, right? And so that's one thing you guys came up to the meeting today and got to see a lot of that. And we encourage all physicians to come to our monthly meetings. You can log on online. You can come in person at the down here at the Medical Society building. But in closing, just a little discussion on the value of the Medical Society for you and how that helps private practice.
Yeah, I was thinking about that as I was looking at the program for the meeting today, and they were talking about the community outreach and the events, and thinking about what Dr. Smith said about how difficult it is and how much of a shock it is to have to get out and meet doctors as you start private practice. I think the Medical Society is such a great way for new docs, especially in private practice, to go to these events, to meet the other docs in the community, to get involved in outreach programs that allows you, again, to meet additional docs and coordinate with those docs in the community so that they know what you do and get some exposure that way.
Connect with the alliance.
Absolutely, and connect with the alliance.
Yeah.
I think it's super important, especially as we talk about reimbursement and how Medicare wants to take a 2% reduction this year. I think over the last 6 years, they've continuously made reductions, and you can't get mad about it if you don't fight for it, right? So I think that if you are going to be mad about it, which we all should be mad about it, as other insurance follows Medicare, that we have to be involved. We have to join our societies. We have to pay our dues so we can put up the good fight.
Yeah.
Yeah, I think, like Dr. Williams said, having someone there that's making that fight and being a part of that is invaluable. And then I know I've also personally benefited from some of those card swap events, those young new physician nights, as well as the event they did with the medical students, inviting medical students in and trying to connect medical students with physicians. And like we said, that mentorship can be invaluable. I know I benefited from it from Dr. Slaught, and hopefully we can continue to pass that down towards the future generations.
Yeah, just to piggyback on both of what you both said, I think I was a little, underinformed. I didn't realize how much the society was doing and how much they were fighting. So my eyes were really opened about 2 years ago when I started to get more involved and just, it's just incredible work that the society is doing. So I think that it's important for all of us physicians to support them in any way that we can.
All right, y'all did great.
Thank you for having us.
Thank you for coming.
Yeah, thanks for having us.
So please subscribe. You can follow us on YouTube, Spotify, Apple, and thanks for tuning in.